And first of all, I am thankful, although we making a little late start, but I am very thankful that Dr. Robinson is okay, because that's the bottom line. I was very concerned about that because I know we communicated today and I couldn't understand what happened, why I wasn't hearing from her. But then, as you said, this is internet stuff and you just never know where we have all these access and media and but sometimes they fail us, and this is one of the time. But thank God she's okay. Internet comes back, and so we can now go live. All right. So if you've been waiting and wondering, I'm glad that you're there. And here we are. Now, what you can do, my friends, wherever you are, you can share with your friends and your family wherever you are, so everybody can join us and still enjoy this conversation, because I think it is going to be a really good, interesting one. All right. Welcome to Let's Talk with the Doc. I have with me tonight a very prestigious lady, I must say. And I will get to know more about her, and you will get to know a little bit more about her as well. And then we will get into the interesting things of her life that she's involved in. I must say that she has a very illustrious bio, as brief as it is. I'm beginning to wonder, how old she is to have accomplished so much and still look that young, but maybe we'll find out some more. So thank you. This is well, Dr. Robinson. Thank you for joining me on Let's Talk.
Thank you for having me.
And I am glad, as I said, that you are doing okay, because that's the bottom line. I needed to be doing okay, because if you're not okay, then nothing is okay.
I'm grateful also.
All right. So I am just glancing at your brief bio. We're going to run through a little bit of that first, and then we will go into the infectious disease part of your profession. I'm just letting my listeners know, and your friends who don't know, and my friends who don't know, that Dr. Robinson is joining me live from Jamaica. Live from Jamaica. Where in Jamaica are you right now?
In Kingston.
Kingston. Okay, well, if internet is gone in Kingston, then it's kind of gone, So
it goes in parts from.
Okay, all right. Well, she's joining me from Kingston, Jamaica, and just a little brief synopsis of her bio. After completing her MBBS, Bachelor of Medicine and Bachelor of Surgery, at the University of West Indies, and internship in Jamaica and the Bahamas, Dr. Kathy-Ann Pate Robinson did her training as a wellness specialist in Japan in 2007. Interesting. So, are you bilingual to start with?
I did 15 hours of Japanese language classes while I was there, which was very interesting.
15 hours. And what was your level of communication skills with that 15 hours?
Things like, hello and bye-bye and welcome and thank you and excuse me.
Okay.
And where's the bathroom?
Oh, okay. All right. Just to get along. All right. Well. That's interesting. All right, and subsequently completed her DM in internal medicine and a fellowship in infectious disease at the UWI. She's currently a consultant and AMP. What's that? As an AMP associate
lecturer.
Well, it says a consultant and AMP.
Oh no, I don't know what happened there.
Yeah, maybe that's a printing from my computer. So all right, let's go on. Associate lecturer in the department. Huh?
It would be consultant physician in the Department of Medicine.
And associate lecturer in the Department of Medicine at the University Hospital of the West Indies, and sits on the institution's COVID task force. Well, that tells about the relevance, right? Because that is a very relevant task force right now. If everybody need a COVID-19 task force. All right. And she's a member of a number of learned societies, including the Infectious Disease Society of America, All right, so she got connections here. The HIV Medical Association, the International Society of Infectious Diseases, and the Medical Association of Jamaica. The subject, the subject of her research, the subject of her research studies include sickle cell hepat, hepatop, hepatopathy,
Hepatopathy.
hepatopathy,
Mhm.
all right, and sepsis and chikungunya.
Yes, chikungunya.
Chikungunya. That's a lot. That's a whole mouthful there that I have to digest and try to even call these words. So and then she's married. How long has you been married? Have you been married?
15 years this year.
15 years. All right. She's counting. And then in her own words, she has two rambunctious boys. And that's a big word that we try to call those in syllables, right? Rambunctious boys, whatever that is. How old are your boys?
Well, they're a little older than rambunctious now, but they're 14 and 16.
Oh, 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 okay. All right. So those are big young men.
Yes.
Those are big young men. And she's an avid reader and a foodie. What's a foodie?
Somebody who likes good food. Or food takes up, you know, it has an important place.
It's an important place. All right. All right. Well. Thank you again for joining me, and I'm looking forward to getting an understanding of some of these infectious diseases, and that's where your profession is. And it is interesting because in looking at your achievement from where I am, and your accomplishment, one of my observation is how soon people like you are able to climb the ladder of success at this rate. I am not gonna ask your age, but I look and say, yeah, I don't think she's that old. You know, when I was a younger, much younger man, it would have been people looking like me, at this age level, kind of, who would have achieved all these things and get the recognition, climb the ladder to reach at this level where you are. And one of the questions I have, is that uh, going to medical school back then seemed like it was a journey that was, that couldn't end. And then eventually, when they finish medical school, it's like step by step, I step to see if they climb up the ladder. And right now you're so involved in so many areas. So my one of my question is it do people move faster now than back then when you if you do a comparison of progression, say 20, 30, 40 years ago as opposed to it now? And if yes, is that because they offer more incentives, more intensives, not incentive but intensive courses, or what are what's the progression, and how do you achieve so much in such time to be this young? Maybe I'll ask. So I don't know the length of time it takes you, but
So between, I suppose I've been a doctor for quite some time. Would be about 15. Hmm. No, it would be 16 to 17 years now.
okay.
But, in that time, and I suppose in the world of now, that's
Mhm.
not such a short time in which to do some of those things. It sometimes is a matter of opportunity as
Right.
well, because there are programs now that are perhaps shorter than medical programs used to be, even
Mhm.
though the amount of information that is available and that you have to try to assimilate is far greater, because information has exploded in every career that exists. So there's always so much more. And you always hear people say, oh, the kids are so much smarter these days.
Yeah, that is true.
I don't know if they're necessarily smarter, but maybe more exposed
I
and pushed harder in an academic way from a younger age
Hmm.
everywhere. So, with that increased exposure and then the advent of the internet, you can access information in seconds.
Hmm.
You can do courses online. So education has become a lot more available and there is a lot more global connection. So you can be going to school and form linkages in different countries across the world, even though you may not be traveling very far, or you can access opportunities in other countries that may be far away from your country of origin, which I was able to take advantage of when I went to Japan to study wellness. So it is something that there is a bit more flexibility in the pursuit of education now than there used to be. And you have to push. You can't really stop, because if you stop, you don't want to start again.
I think that kind of answer my question to a certain extent because you know I think accessibility
Mhm.
it makes a difference. You can find things everywhere. There, I would imagine that the amount of books that people would have to go through and carry around and go find this in the library and all of that stuff, 20 years ago when there wasn't, not 20 years ago, but say 30, 40 years ago for some people when they were just doing medicine, they have to get
10 years ago.
10 years ago. Okay, all right, because I've never been in that field. So I'm gonna take it from you. 10 years ago it was different. Okay, so the accessibility, and you don't have to do all the long distance traveling and that the back and forth. You can do it right there, download it right where you are, and have to go to the library. So everything, at least it takes off maybe what 25% of time, maybe.
It varies. I mean, now these days, you can, for example, as a physician, you can be with a patient and go on your phone and look something up and be able to show diagrams or videos, and you can bring the education that you have access to directly to your patient,
Mhm.
which was not so possible before you had smartphones, and
Mhm.
smartphones are not that old.
Well, that's true. That's true. Yeah, because people now can walk with it in their hands,
Yeah.
and it's all there. Yeah. So yeah, now I that makes a lot of sense to me. It makes a lot of sense. So accessibility, and as you say, in every field of study, there would be those kind of privileges that people can find to move them along, and even when class, and I think again, because you can do that any time of the day or the night, you can continue to work because of internet access and Google and Wikipedia and all of those things, and you can find things to continue working. So that makes a lot of sense. Makes a lot of sense to me. All right. So the, Dr. Robinson is she specializes in HIV medicine and all the infectious diseases, wellness, and all of that stuff, as others have seen. Before I get into your field of specialty, I was kind of looking on infectious diseases,
Mhm.
and and I look at what is considered the five most infectious disease. I don't know if what I found is the same what you have. Maybe you can attest to that. But I noticed that at the top of infectious diseases is hepatitis B.
Mhm.
That true in your finding?
Depends on your country,
Oh,
because
that based on your country.
it depends on your location. There are different countries and different regions that would have different concerns, and different diseases would be the top one or three or five or 10.
Okay,
Um,
so they can
it
vary.
varies.
Okay, there's not the exact order, but they
No.
might be the same, but it depends on where. What something that jumped out at me is that it seems like hepatitis B, though, affect more people than all the other diseases, because I was shocked when I saw that more than 2 billion people, more than 2 billion people has been affected, and that's more than a quarter of the world's population, or somewhere about a quarter of the world's population have been affected, but with hepatitis B. Do you know what's the driving force? What's the reason behind that, and why is it so infectious and so broad spread?
So it has to do with a number of factors. Some of those factors are to do with us and other hosts being vulnerable. Some of those factors are to do with how it is transmitted.
Hmm.
And some of those factors are to do with the virus itself. So, for example, if you compare hepatitis B and HIV, hepatitis B can survive in, if you want to call it old blood, blood that's not fresh in your veins,
Hmm.
for a significant period of time and still be infectious. So you can come into contact with blood and body fluids containing hepatitis B and it not be fresh blood or body fluids, and you can get infected that way. For example, if you had a cut or something like that. So, hepatitis B more commonly infects people through needle stick injuries than something like HIV, which is not such a robust virus when it comes to sitting down in the environment and dies fairly easily. Some of the studies that have been done have said about 0.03% risk of transmission of HIV, whereas hepatitis B will be many tens of times that, and hepatitis C even far more common. So sometimes it's a combination of factors, and then are we vulnerable? Are we susceptible to the organism, or are we effective at killing it? And if we've never been exposed and we don't have a good immune response that is quick to eradicate something like that, then we can be easily infected. And with hepatitis B, it is sometimes eradicated very early in the
Hmm.
infection, and sometimes it sits in your system forever after. So it's one of those things that can become a part of your life for the rest of your life because your body was not able to eradicate it. The infection became established, and then you are at risk of spreading it to anybody who has contact with your blood or body fluids. So it
So,
can be challenging.
so it can hepatitis B can sit in your body
Mhm.
for the rest of your life,
For those of
and
chronic infection,
for,
yeah.
for chronic, and say, okay, so the possibility is there. What are some of the reasons or the factors that your body can shake it off? Weak immune system, what?
I
lack
don't
of
know
lack
that
of something.
I don't know that there's any good evidence to say that these are the factors, one, two, three, four, five. We know that there are some sort of general factors that have an effect on that. So how robust your immune function is, and that can be multifactorial. It can do with whether you are of good nutrition, or
Mhm.
whether you're lacking in certain vitamins and cofactors for your immune function. For
Mhm.
example, there's a lot of evidence in this whole COVID era that vitamin D is far more critical than people would previously have thought for our battle against viral infections. Before, there was evidence that, it might be good for people with cancer, but we're finding out so much more about its effect on the immune system. And when you look at just how well nourished somebody is, whether they eat healthy, are they getting a wide variety of minerals and nutrients? Do they drink enough water so that their circulation is appropriate? Are they eating enough protein so that they can actually make the building blocks for immune function? You have those kinds of things, and then you have environmental factors. How is
Mhm.
the environment affecting your health? And what about exposure to drugs and toxins? There are a lot of things that make it easy or hard for us to function on a background of what our genes give us. Our DNA codes different factors. Some of us are Intrinsically, this is very rare though, intrinsically resistant to certain viruses. So there are some people in the world who cannot be infected with HIV
Mm.
because they don't possess the cell markers and cofactors that HIV uses to get into their cells. So HIV could get into their body, but it would never be able to establish an infection because they are genetically not vulnerable to that virus. And so there are a lot of different factors that play a role.
We maybe could get into some of those um factors later when we hit the HIV thing. But I and then as you were saying that the FB
Mhm.
thing could hang around in your body, and it's like they're laying dormant kind of, but then you're still infectious.
Yes, you're still infectious, even if you don't actively have any disease that you're aware of. You have an infection present, the germs are circulating, they may be multiplying, so they're present in your body. Sometimes an infection will be present and the germs aren't really multiplying, but they're not dying either. And so,
Okay.
if an opportunity presents itself for them to travel to a new host, then they will travel and try to establish a new infection. So it's sometimes a matter of opportunity for the germs as well, not just for us.
An opportunity for the germs
Mhm.
because it wants to infect people.
It wants to survive and
It wa-
procreate, make more copies of itself,
oh
have
boy,
many viruses.
I would to God that we were able to know, exactly that what where it is and what it is and what we could do to. But if you don't know, then it makes you're just like, okay, a spreader, as they say, like a spreader going around and not knowing how are some of these transmitted by blood connection, uh, etc.
Different types are transmitted different ways. So, for example, people have gotten things like HTLV1, hepatitis B, hepatitis C, HIV from blood. So maybe in a past decades, you could have gotten it from a blood transfusion before we knew that you needed to test for these things.
Mhm.
And then some people will get it through sexual activity. Some people will get it through passing through the birth canal when they are being born. So there are different ways. And there are, as you know, COVID is different. It goes through the mouth and nose into the
Mhm.
respiratory tract
Mhm.
primarily. And there are others that will get through your skin. So herpes can be something that you may just need to come into contact with and it will get in through your skin. It doesn't have to be a more vulnerable spot.
As I listen to that, it just tells me how vulnerable we really are, and we can be so susceptible, and there's so many things are passing by, or we're passing by them, and we're touching here, touching there, and we are so vulnerable, and we don't even know when we contract something, or we're infected by something, and we're just going along our normal lives. We could go out and pick it up and we bring it home, and then we just like killing everybody.
Well, the good thing is we were created to be very able to protect ourselves without meaning to. So our skin is our best protection. It provides a barrier to many germs and keeps us safe from things that we never knew we were at risk of catching.
Mm.
But sometimes
Well,
our
thank God for
protective
that.
systems aren't enough.
Thank God for that. And what we understand sometimes, when your body develops a fever, right? You develop a fever, it is your body shaking off something that it doesn't like. Sometimes that happens, right?
So it can be different things. Fever happens because of what we call an inflammatory response.
Right.
So you can think about it like an invader or enemy coming to your shores and wanting to take control of your country, and you're angry and that they're trying to do this, and you bring out the army, and having the army come and set up camp on your shores is doing damage to your own environment
Mm,
because they are taking up space that they wouldn't normally. They're going to be littering, they're changing the whole environment. It's
mhm.
part of your body's response against the germs or against a cancer or against some other process that it doesn't like. But it can also be damaging, even though it's protective.
Interesting, and I like that analogy. Yeah, there's an enemy invading my territory. This is foreign object thing, coming in and putting up resistance. But at the same time, I gotta fight to keep it out or keep them off. But at the same time, I'm wearing down my own self in the fight.
Yes.
So then I have to if I can know what I need to do to build up my surrounding or my territory or my ability to resist, then I can keep myself going much longer. The problem is if I am fighting off things and wearing myself down in the process, and eventually it might turn around and wear me out and I die from it as a result.
Use up too many resources, you don't have enough left to recover.
Yeah. Very interesting. I'm talking to Dr. Kathy and Pete Robinson live from Jamaica. She's on Let's Talk with the Doc, and I am so appreciative. And of course, yes, those who are looking for us from 8 o'clock. She had some mishap, unfortunately, but I'm glad that she's okay. So she's a specialist in infectious diseases, and I just started to break. You made mention of the Hep C. I think I have heard more concerns
Mhm.
about Hep C, yeah, than I have heard about Hep B. At least in the United States, I've heard that you have to get the Hep C vaccine or things like that. To even work in the hospital and all of that stuff, you have to be vaccinated to prevent that and all of that stuff. What's the reason for that? Why is that so important, especially working in the hospital system?
So the vaccine you're talking about is hepatitis B. Hepatitis C, we don't really have a
You're
vaccine.
right. Yeah, you're right. The hepatitis C is the one that can stay there forever and it can spring up again, right? It can.
Well, hepatitis C is a little bit different from hepatitis B. So, whereas hepatitis B can go into your cellular nucleus where your DNA is, hepatitis C doesn't actually invade the nucleus of the cells, which is why you have all these ads for these medications to treat hepatitis C and cure it, because you can actually cure a hepatitis C infection if you use the right medication for the type of hepatitis C you have. Then you can eradicate it from your system and you can clear the infection. Whereas for hepatitis B, if your body doesn't manage to clear it on its own, it's generally, it becomes a part of your life and you can't eradicate it after it has established itself on the internal aspect of your cell nucleus.
Okay. All right. All right. Thanks to my friends who joined and those on Facebook, those on YouTube. Good to have you and I appreciate you. Just remember that you can hit your share button and tell your friends that I'm talking to Dr. Paige Robinson, and she's an infectious disease expert. That's her field of profession. And if you want to learn about diseases, this is the conversation to have as I am going to and keep talking to her. I noticed that you uh, the chikungunya.
Yes.
I was kind of I don't remember hearing about that one when I read that, so I had to go look up what's chikungunya, and then I realized that it is something that's transmitted by generally by mosquito bites.
Yes.
It has sometimes it has similar symptoms that are like dengue fever. It could be misconstrued to be either or. And so, how do one define or is there any way of differentiating because of the symptoms, the similarity of the symptoms?
Not reliably.
Not
So,
reliable.
I mean, it's a particular concern for us in the Caribbean because we have a tropical climate. Mosquitoes are very common. And even though you do have mosquitoes in the United States, you have a lot more of your country in the temperate zone, where mosquitoes are less likely to be as significant a concern, and you have more temperature controlled environments.
Mm-hmm.
So the exposure is a lot less. In 2014, chikungunya came to Jamaica for the first time, and that was an experience and a half for the Caribbean population as a whole. It had started, the most notable um, evidence for chikungunya being a significant disease was from La Reunion, and then it really was in the old world for a long time, but with global travel everything eventually goes everywhere. And so with chikungunya, we noted that there were some things that were similar to dengue, and there were some things that might be more common with chikungunya and less common with dengue. But there was so much overlap with the symptoms that, although in the beginning it was very reasonable to assume that if you came in with those symptoms in the height of that epidemic, that you had chikungunya, there were a few people at that time who had both dengue and chikungunya. But
Mm-hmm.
the majority of people coming in with symptoms of, say, fever, intense pain in their joints, some people had a lot of diarrhea, some people had headaches. There were different kinds of a variety of symptoms. Some people had a rash, some people had swollen lymph nodes. So depending on your symptoms, in keeping with this sort of viral picture that looked like dengue but was a little different, at that time in 2014 you were assumed to more likely have chikungunya than anything else, and we did as much testing as we could. But there were a few people who came in with both chikungunya and dengue at the same time.
Mm-hmm.
And there were a even smaller number, I think, who had dengue by itself while chikungunya was going on and didn't have chikungunya then. The unfortunate thing, I suppose, is that it has become a part of our circulating background viruses, because we have mosquitoes all the time that can transmit dengue and chikungunya and Zika. We have mosquitoes that can transmit many of these arboviruses, these mosquito borne viruses. And so anybody who is not immune is at risk of potentially getting it when there is a surge of mosquitoes in the community, because those viruses continue to circulate.
So do is there a season, do these come by a season or a type of mosquito that is just evading or the area, and then they are the infectious or the carriers of this kind of disease? So there is a season, because you said 2014
Mhm.
it was very rampant. This
Yes.
is 2021.
Mhm.
How would you say the stats or the numbers are of those diseases? And as you make mention, the similarities of the symptoms, as it's compared to dengue fever. I
Mhm.
have been hearing, and by the way, let me just say, the way that you say chikungunya, it reminds me that I heard that some years ago, because I'm just trying to say it, but you saying it as a professional, I say, oh yeah, I actually remember hearing that this chikungunya was making inroads in Jamaica a few years ago. So I have heard it before. So I have been hearing that some places in the Caribbean that there's dengue fever rising, and then how is that in Jamaica right now? Dengue fever, chikungunya. How are those affecting Jamaica now?
So between 2014, about July to September was when chikungunya kind of took off in 2014. So leading into 2015, we had a lot of chikungunya because our population was unexposed. We had no immunity. It just went straight through. Almost everybody got it. So then the majority of the population since then has been immune. And slowly you're building up people in the population now who've never been exposed and are therefore vulnerable. So we have cases every now and again. and we don't test for it as routinely because the number of cases is far smaller. It will be a few here and there, nothing significant. Um, it is notable that dengue has been perhaps one of the most rampant mosquito-borne viruses for us. There are four types, and we have all four types in Jamaica.
Yeah, all four types of dengue in Jamaica right
Yes,
now.
yes, always there. It's always circulating, and you rarely get infected with the same one. I don't think that's very common at all in any region, but you can get infected with all four. And the unique thing about dengue is that each time you get infected with another type of dengue, because of your previous immune response and priming of your immune system to attack, there is a significantly increased risk of collateral damage. So,
Mhm.
people who've had dengue before are more likely to have severe dengue or to
Mm.
have the bleeding complications that can come with dengue.
Wow.
And if you've had dengue two times, you're even more at risk. If you've had three types before and you have the fourth type, then your risk is far higher.
So one, two, three breaks down your system and
It's
make you
more
less
it's more
resistant.
like
Or
an irrational person. If you have a hot button topic, this is a pet peeve for you, and somebody pushes your button today and you're already kind of upset, and tomorrow somebody else pushes your button and you get even more upset. It's more like that. The response is not,
irritating, aggravating.
the response is more damaging than protective.
Okay. Wow. Okay. Okay. Somebody asked a question here. Does one recover completely from this?
Most, but not
Most
all.
most do recover. Most recover.
There has been a significant link between chikungunya and rheumatoid arthritis, and also persistent joint issues that may not meet the criteria for rheumatoid arthritis but may linger for many months. There are quite a number of people who have had months and possibly even years or permanently develop joint challenges, and it can trigger rheumatoid arthritis in those who are susceptible to that. So there are some people who didn't have rheumatoid arthritis before, got chikungunya, and then developed rheumatoid arthritis afterwards.
I was looking at a graphic on the chikungunya, and it almost looked like measles, or
The
like the rashes almost look. So those are individual bites, or something that spreads as a rash. What is it?
So it's part of the immune system's inflammatory response. That rash that comes with chikungunya tends to come not at the beginning, but as you go into the infection and you start to clear it, a lot of people will develop that rash. It's like red bumps on the skin, it will
Right.
happen on the face, and it's a little unusual. That's one of the things with chikungunya that you don't usually see with dengue. Dengue doesn't give you rashes that you can feel typically, but chikungunya's rash you could feel.
Hmm.
Dengue's rash tends to be what we call macular, meaning there are blotches, there are small blotches on the skin, small reddish blotches, but you can't actually feel them. If you feel your skin, it feels normal. So
Okay.
they're flat.
That's interesting. That's interesting. That is interesting, really. Again, I'm talking to Dr. Kathy and Pate Robinson, live from Jamaica, and I am so happy to have her with me. And I am sure this is not the end of it, because with all these diseases and the developing diseases, and there's another recurrence of another disease. And if I have a doctor that I can call and say, Doctor, can I talk to you about this disease? And I'm sure this is not the end of our relationship in discussing diseases that are affecting us here and now. Um, how would you say that? Because I noticed that you're on the COVID task force in
Mhm.
Jamaica. How is COVID infected affecting Jamaica right now? What's the infectious infection rate in Jamaica right now about it with COVID, and the death rate if there's the hospitalization, etc.
So for COVID right now, our numbers are climbing. Um, we are actually in the midst of a surge that started shortly after New Year's, and our numbers have been going up pretty steadily. We had a few days ago, we had about 400 plus cases positive from the testing of that day, which is an extraordinary number for us. I
Just
know
one day,
in one day. I
one day.
know that the numbers in the United States and many other larger countries are much higher, but for us, that was quite significant. And we have been climbing there with sometime with we were at maybe I suppose tens, 20s, and then we started to climb rapidly over the course of last month into this month. We had a little downturn in the number of positives coming up per day, but it's still early days to tell. We have had a few more deaths
Mhm.
over the course of this year so far. And the if you think about when things started for us in the 10th of on the 10th of March last year. That
Mhm.
was when we first had COVID come to Jamaica. And between March and April of last year, I think we maybe had two, maybe one or two deaths.
Mhm.
I think by May we may have gone up to perhaps about 10, somewhere between 10 to 14 deaths between March and summer in that period. And we had shut down the country for a while. After that time, then we had a little lull where we thought, okay, maybe we're getting rid of it. But when
Mhm.
we opened the country again, then there was a slow increase in cases because we had so many travelers, especially Jamaicans coming home,
Yeah.
and the the adherence to things like mask wearing all the time, and
Mhm.
that's difficult for anyone to do consistently.
And
And
especially if you are almost required in the US to wear it, and when you get to Jamaica, like, oh yeah, thank God I can free myself. No, and
I
then
suppose so. I have heard though from Jamaicans who have gone to, for example, other states to have traveled to the United States and
Mhm.
visited. They quite a number have said that at home here they felt a lot safer because more people were wearing masks. And I was told by one or two people that it was almost as if it was bad for them to be wearing masks in the places that they visited in
Mhm.
the US, because the prevailing attitude seemed to be you're crazy to be wearing a mask at
Yeah,
the time.
yeah.
And so, our mask wearing is not so bad. You can't go into a workplace or a business place without a mask
Well,
here.
that is good because that helps. Whether people want to resist it or no, but the science is talking about we going with the science. The science says it helps. So if we can follow the science, even though it may be a little uncomfortable, I'd rather be uncomfortable than die. I'd
Yes.
rather be uncomfortable and live than die comfortable. so, so somebody asked a question. Joy asked a question. It says, now you arose my curiosity. Years ago, they said I had RA. I don't know what RA is. However, all the tests proved negative. I had severe joint pain and swelling. I got well after years of suffering. Could this have been the chikungunya? Chikungunya.
Well, it depends. Could you have been somewhere where you could have gotten it? Because chikungunya, for the most part, I think almost everybody who's had chikungunya in Jamaica would tell you that they had significant pain with it. Most of us who got it, I got it too.
Okay.
Most of us who got it had intense joint pain, even if it was only for a few days, sometimes to the point where you couldn't touch that part of the body. You couldn't touch that joint. You didn't want
Mm.
to rest it on anything. Some people could not walk for how severe the pain was. And if you've not been in a country or setting where you could have caught chikungunya at a time when it was circulating, then it's perhaps less likely.
Okay.
And there are many other viruses that can give you joint symptoms. Chikungunya isn't the only one. It's just it was notable for us. But there are other viruses that can give you um, a more autoimmune type picture with how your body responds. And that can sometimes lead to challenges or complications over time. It's just that for us, chikungunya was the notable one in terms of joints, but there are others in other places.
Wow. Dr. Kathy Ann Pate Robinson is live on Let's Talk with the Doc, and I am so appreciative. I like to talk about these things because it educates me and it helps me to educate others through their joining us. And so I find this to be very interesting. And I think, brother, one of my friends in Jamaica, Pastor Salman, good to see you, man. If you're still there, that is good to see you. Good to see you. Welcome to the conversation. All right. So name from your knowledge, what are some of a few more of the infectious diseases, and what are some of the non-infectious diseases before we go into the HIV and AIDS aspect of this meeting?
So, when we talk about infectious diseases versus diseases that are not infectious, most of the time, as doctors, we tend to focus on what we call the chronic non communicable diseases, things like high blood pressure, hypertension, diabetes, high cholesterol, obesity, because those are things that are taking over the world. Obesity and being overweight is a significant risk factor for many lifestyle related diseases. We also call them lifestyle related because what you eat, whether you're active, what you drink, what you do with your body has a significant impact on your potential to develop these illnesses.
Mhm.
So, when we think about the infection side and what's opposite to the infection side, very often we think about things like hypertension and diabetes and obesity. But you also have other things like
Mhm.
cancer. Cancer is seemingly taking over the world these days. There is at least one cancer in the top 10 causes of death for almost every country that exists.
Wow.
And I don't know if that was really the case 50 years ago,
Mhm.
although our ability to detect it is far greater now, but it just seems to be a little bit more common than you would think. The detection was the issue.
Mm. Wow. All right. So I am looking here now. And we are coming down into the your area. And I don't know if we can cover all of them because I find it interesting with the wellness and all of that stuff. And what are some of the things that we need to do keep ourselves well? But we'll hopefully we'll get to that point. What do we need to do? Steps to take to help to build up our immune system, or to help to build our resistance against some of these things. And I know you run around where you are in Jamaica. Growing up, we just run around. We're open to everything. Little streams, little rivers, mosquitoes, as you said earlier, and all the little bites. And but as you said earlier, thank God that the body is designed to detect and to resist as much as it is able. Some things it can, but some things it can. An infection occurs when a microcosm, a microorganism enters a person's body and causes harm. So and then I read something here that says the microorganism uses that person's body to sustain itself, reproduce, and colonize.
Mhm.
Tell us more about that.
Colonization.
Tell us about it it finds you, the
Mhm.
disease finds you by whatever means, and it uses your body because it feeds on it, like maybe like a parasite, right? It just feeds on your body, sits there. It's like a tick. Jamaica, we say we have ticks. You can pick off ticks, and that thing we come from what we call it grass lice, that little thing that you barely could see, and it finds a little place and it sticks there and it stays there and it stays there and it grows and grows and grows. And, until one day you
That's
find
a
this.
horrible picture.
Yeah, I know, but it happens. It happens.
Agreed,
It
agreed.
happens. So it's just a place where you can see on your body, and you don't really feel it because it just sits there and gradually sucks your blood and grows itself.
You're going to have people running away from you now, you know,
Not me. I've not seen
or
grass.
maybe from the show. Okay, so
But I think what they would do is to search more to make sure they don't have any growing in the way.
that's terrible, Bishop. But germs are good and bad. We need them and we don't want them. And some of them keep us healthy. So, for example, humans can't make B12. Animals in general don't have the capacity to make B12. But in our diet, for those of us who eat meat, then we get B12, this essential vitamin that we use to build new cells. We get it from meat. But where does the meat get it from? The
Hmm.
meat gets it from bacteria.
Right.
So, bacteria in the gut of herbivores make B12 and then they get it absorbed into their system because it is made by these germs. If the germs didn't make it, we would never get access to it because
Mhm.
we can't make it ourselves. So some germs are very important. And that is so we have germs that we have a symbiotic relationship with. For example, some of our gut bacteria help to make vitamin K. So we are able to have our blood clot to close off cuts and damages because we have vitamin K in our system. And that
Vitamin K.
vitamin K, we don't make it, we get it from the gut bacteria that we have, or from our diet, or both. So we do have a need for these germs. And all there are some diagrams online that show you that you have billions of germs on your body from the top of your head to the soles of your feet. Your skin is covered in germs, and you have germs all through your gastrointestinal tract. So as you get into your mouth, all the way till it comes out, you're covered in germs. And the amount of germs on and in our body, and I say in loosely because in the gut is still outside of our closed off areas.
Hmm.
But all these germs in number are far more than the number of human cells in a body because there are billions of them. So
Wow.
they're far more than the cells that make you you.
Wow.
So we need them.
So
But
we're just germs and legs walking.
well, it's good and bad because if we have good germs on our body that are not germs that tend to cause disease, they're living with us in harmony, if you want to call it. And there are some that they have colonized our bodies. They're sitting there, they're using us as a house, but they don't feed off of us. And those germs are very helpful because when a bad germ comes along, a pathogen, we would call them, something
Mhm.
that likes to cause disease,
Mhm.
then the good germs that don't cause disease will buff that
Put up
germ.
a fight. Put up a little
They'll be like,
resistance.
okay, you don't belong here. This is our house. Get out of our territory. And so that helps to protect you all day long. You come into contact with many germs, but they don't take up residence because you are already the residence of many others.
Wow.
So they're very important. And they help us to stay free of the ones that will do us actual harm.
This is interesting. I am learning, and my friends who are here, I appreciate you joining in. Kian, good to see you. Debbie, good to see you, and all those who have joined us and listening to this. Primrose, if you're still there, good to have you. Don't forget, you can still share. You can still hit your share button because that's the power that you have. The power you have is to hit your share button and invite your friends to listen to this conversation, even when it's done and you share it, others will be able to hear and be edified, educated, and learn what are some of the signs and symptoms to look for, how to do an assessment of maybe where they are and what's going on. All right, Dr. Robinson, tell me now about the HIV AIDS, the HIV and the AIDS and the medicine. I know there was a time. I know there was a time when it to say HIV or to say AIDS was like a curse word. It was like an abomination because there was at least when it came into Jamaica, there was the perception there was the perception that if you had HIV AIDS, I don't know why they call it HIV AIDS because they're two kind of separate things. One is the human immunodeficiency virus, and one is the you actually accumulate it. You have been affected by it. So they're kind of separate, but one leads to the other. But I remember there was a time when HIV was like if you have HIV, you were there was a stigma attached to that because some people think you could only contract it one way,
Mhm.
right? And now we understand that there are many ways you could actually contract the virus or be infected by the HIV before it gets to AIDS. So give us an understanding of for those of us who don't know, give us an understanding of the HIV and the AIDS and the progression of that.
All right, I'll try.
Yes.
It's
If
sometimes people.
anybody if anybody can try, it's you.
So HIV is a human immunodeficiency virus, and human because it affects us, immunodeficiency because it destroys your immune function so that you can't fight off regular germs, you can't easily destroy cancers. I don't know if many people understand that our immune system is constantly protecting us not just from germs or microorganisms that can attack us, but also protects us from things like the development of cancer in our bodies. We have immune cells that circulate, find cancer cells, and destroy them. And so, if we didn't have that immune function, we would have cancers far more common than we do now.
That's interesting.
So, with human immunodeficiency virus, it's weakening our immune system, removing that ability to fight off infections and cancers and other health problems. And if you get to the end stage of that destruction of the immune system, then you develop AIDS or acquired immunodeficiency syndrome.
Hold that note before you go further. I because you said something that is interesting to me. So don't forget your point. Um, you said that as a result of the other viruses or whatever you call it or the good virus and stuff like that they help to detect things like cancer and kill the cells.
Mhm.
My question now is this the fact that we have seen cancer rising to an astronomical level, like these days it's one of the most common thing is cancer. Are these a result of a breakdown in our own systems to shake these things off why we are infected so frequently now?
We like to say it's multifactorial. There are many factors that play a role. So, yes, it means we're very often more vulnerable. So, for example, inflammation. We mentioned inflammation before. Inflammation has to do with an irritative sort of response in our body's internal systems to fight against something it doesn't like. But there are, for argument's sake, a number of foods that we know are pro inflammatory. They promote inflammation in our bodies. Even something as simple as sugar can promote inflammation. And when you look at what they say cavemen used to eat, I don't know who
Yeah.
they is, but they say cavemen used to eat tough wheat and other things that we don't have anymore. and they used to eat nuts and berries and kill their own food and that sort of thing. And
Mm-hmm.
these days we have very highly processed foods. We have
Mm-hmm. Mm-hmm.
very different eating and drinking habit. We consume a significant amount of sugar and salt, whereas there was a time when humans didn't really have access to sugar and salt.
Mm-hmm.
Maybe sugar and fruits, but we didn't have all these nice, comfortable things to eat and drink. And to some extent, cancer is linked, different types of cancers have been linked to various dietary factors, to habits such as smoking or increased alcohol consumption or increased sugar or exposure to soy or different things that we put in our bodies or that we don't put in our bodies. You know, for people who don't eat enough fiber, then you don't maintain your colon health. And if you don't maintain your colon health, then your risk of having cancer of the colon is increased. So there are a lot of factors in our lifestyles that promote things like cancer and take away from our health and wellness.
I am so gonna have to get you back to talk to Dr. Robinson. This is incredible because there's so much information that I'm gleaning from the conversation because I have been contemplating and I didn't have the medical background to come to a conclusion, but I've been contemplating what is causing um this rapid rise of cancer of all sort and types,
Mhm.
and now I am beginning to grasp some of what you're saying that makes a lot of sense to me because it appears that the our immune system has been compromised by the a lot of processed things that we eat that doesn't give us the nutrients
Mhm.
that we need to resistance because they have been processed and all of that, so the value of them has been burned out. I remember when we were growing up, we ate everything that we grew from the field. They talk about organic stuff. We had the real organic stuff because only some people could even afford to buy fertilizer. So we mulch or we get animal manure and that's how we kind of make things more bulky, grow bigger, and all of that stuff. But I consider it to be real organic. The bush tea and all the things that we had access to, now everything we eat and drink comes through manufacturers and canned stuff. We have even our Jamaican ladies now who are eating pre-boiled bananas and all that kind of stuff. So nobody wants to peel anything now. So and I'm looking at that, and I'm seeing in the long term it
Mhm.
appears that these are some of the things that our bodies are broken down and we don't have the resistance that we once had to shake some of these things off by ourselves.
There are a lot of things that we do that our bodies would thank us not to do.
And our bodies are asking us to do some of what we're not doing too.
Yes, yes.
Yeah. Like, can you give us one or two things that, like, top things that the body said, please don't do, or can you just do?
Drink water. That's one of the biggest ones.
And tell us the importance of that, because I think because water is not sweet.
No, but it
So
is life.
people want it. It is like, but we don't just people just want a pop, want a can of soda or something, want some syrup or something because we want the thing that is flavorable.
Well, there are a lot of it's hard to talk about those things without saying something specifically about them, but that takes you away from the discussion about water. If you
Hmm.
talk about water by itself, it is necessary for every cellular function. It keeps your colon healthy. It keeps your skin healthy. It helps your organ function. It prevents kidney failure. It allows your heart to pump. It makes your blood flow better. It's just a necessary part of function for every aspect of your body.
I
But if
could
you
just put my
start
hand on here and just show you.
those additives, things like adding sugar or having a soda, a lot.
Look how many empty bottles I have right here. What? Those are water bottles. So I,
Good
I,
job, Bishop.
I,
Good
I am
job.
back. I'm back to my water. I am back. So thank you so much. That is gonna be a driving force in me getting
A lot
sticking.
of the things that we add to water to make it taste nice take away from what we
Mhm.
get.
Right.
So a lot of those compounds can be sort of diuretic. So sometimes when we're drinking, especially sodas and things like that, we think, okay, we are satisfying our thirst, but we don't realize that we're actually creating greater thirst because after we drink it, we're losing far more of our body's water than we actually put in. So something as simple as that is negative on the health side. And then if you think about water as a big one of the big ones that everybody kind of bypasses is the desperate need we all have to rest. Everybody needs rest to recover and function, even something as simple as our memory. Our brain is like a computer. If you never turn off your computer, it is going to malfunction on you. Things will stop working, the mouse won't listen to you, the page won't respond, and you have to restart. And your brain is sort of like that. If you don't get enough rest, your brain doesn't get to go through its recovery cycle, put away its files, get a break, and be ready to come back again. And you will decline in function because of lack of rest. And it doesn't even mean a permanent decline. Sometimes it's just a temporary decline, but you feel like you're losing it.
I pray that God is temporary for me, and I'm going to raise my hand and say guilty as charged. But I pray it's a temporary one for me.
I
Wow.
hope so. I hope so.
This is such an interesting conversation. I'm gonna have to figure out how soon I can get you back, because this is such an interesting conversation, and these are simple things that we're talking about that means that much to our own health, and if we are able to feed ourselves properly, we can help ourselves to resist some of these deadly diseases, because
So
our blood will be healthier, and the water thing, that is interesting, because I think we have not been drinking enough water. And as I said, just like I was like going water a couple of years ago, and then I kind of slack off for some reason. And just a few weeks ago, I said, you know what, I'm just going. And I used to enjoy. I don't do a lot of sweet. Never have done a lot of sweet. And that even if I drink drinks, I kind of water it down. So I'm not a heavy drinking juice guy or sweetie thing. But I find that the more I drink the water, the more you begin to like drinking water, because now it tastes better than the drinks,
your
because it's
body
real.
gets used to what you give it, and it
Exactly,
asks for more.
and it asks for more. Thank you. All right, do you want to tell me something? We're gonna have to come back and continue our conversation, but give us a synopsis on the AIDS, the HIV, and the infection of that, and it getting into AIDS, and then we can wrap it up on that,
Okay, so
and maybe what the medicine is,
and what?
because you are
Okay,
the okay.
so with HIV, we already talked about what the virus is and so on, and the fact that it leads to AIDS, where your body can no longer fight off regular germs. So
Mhm.
whereas before AIDS, a cold would come along, a cold virus, and you would catch your cold, and maybe you might not even notice that you had a cold. You just didn't feel quite so good today, and you're fine again tomorrow. With AIDS, you can't fight off that cold as you would have, and you might have quite a terrible flu. People would call that a flu, even though the two things are a little different. But you might have a terrible cold that might
Mhm.
even lead to a pneumonia because you were not able to fight off the germs that were attacking you. And those germs might be the simplest germs that wouldn't bother anybody, but
Mhm.
they bother you because your immune system is no longer fighting effectively. And so that's the real tragedy of HIV, that it gets your body untreated, it gets your body to the point where the simplest of diseases and infections and cancers that you would never have seen become a part of your daily life and are likely to take you out of existence. So when and there was a time where we would wait till your immune function declined and then treat you because we didn't know any better. But there were a number of good trials that came out from Africa in particular in 2015 that showed that if you started treatment as soon as you found out you had HIV, your chance of maintaining your good normal immune function and improving on it was very high. Whereas if you wait till the HIV has gotten a good hold of you, has started to mash down your immune system, then you are starting from a lower place where the virus has been able to have much more effect, and you may be less able to avoid complications of it, and maybe even less able to recover your immune function. There are some people with advanced HIV who, even though they go on treatment and do well, their immune function never recovers to pre-HIV levels because it has been so damaged in various ways. And so we found that the earlier you start treatment, the better.
Mhm.
And there was a time where we used one drug at a time, and we realized that you couldn't corral the HIV. It's like one of those wild horses. If you come at it from one direction, it runs in another direction. You come at it from that direction, okay, two directions now, it still has a third direction to go.
Mhm.
And we found that if you treated with at least three very active drugs, you were able to get it under control. It had very little chance of escape if the drug levels were maintained in your blood and you were taking them on time, and you did well. Now we have reached a stage where there are such good drugs available to attack HIV that you can even use injectable drugs that will stay in your system for a little longer, so you don't have to take them every day like pills. You
Mhm.
also
Mhm.
have combinations that have two very effective drugs and you don't need a third. So that simplifies things for a lot of people. And you also have once a day treatments, whereas in the beginning of the HIV pandemic, we were giving medications three, four, five, six times a day, depending on the drug, because we didn't have a way to maintain the drug levels stably in the body and the blood. But now we do, and we have better drugs that don't require as much support to do
Mhm.
their work and stay active for 24 hours.
Mhm.
So we've come a long way.
Thank God.
We
Yeah.
are in an era where HIV isn't a big deal anymore, because if you have it and you stay on treatment, apart from the fact that you need to take pills every day for most, you live like anybody else.
Right.
And so it doesn't carry the same level of stigma, although in some countries, the stigma can still mean that you might not get a job. It could still mean that your family might scorn you or
Mhm.
throw you out or burn down your house. So these things still happen, but it's becoming less of a concern, especially in larger countries that are a little more progressive. But, you know, it still has a significant impact on life, and even more so if it's something that you catch as a baby. When children get it, it's much harder, and they tend to die earlier and they tend to not do as well, because going through all the stages of childhood with a chronic disease that people don't want to tell you about in the beginning because they're afraid that you will share that information with other people. And then by the time you really are given the information, sometimes you can't adjust to it. It means that children who get HIV have a much harder time than adults, and
Mhm.
they really don't last as long. They don't
Wow.
get to live a full life many times.
Wow. Wow. That is sad. That is so sad. So it doesn't necessarily. progress is there's a difference in the HIV and the AIDS itself. So the AIDS
It is
is
when
about
HIV has mashed up your immune
explode.
system.
You that's the second time you use that word, and I was gonna say yeah I like that word, and now hear you say it again. So it's a mash up, you know, like say.
That's something we say here at home.
By the way, Dr. Robinson is coming with you live from Jamaica, so mash up we understand that.
It's something you can come back from, though. There are many people who get to the stage of AIDS, but they're not dead yet. They get
Mhm.
effective treatment that does not negatively wake up their immune system, and they survive and they get better and they live fine as long as they stick with their treatment. The challenge is that sometimes in the height of AIDS, when your immune function is very poor, and you get infected with other germs that take hold of you, sometimes waking up the immune system can cause you to have such a terrible inflammatory response that you die because of the reaction that your immune system provides. And so, for people with AIDS and especially certain other infections at the same time, sometimes we don't treat the AIDS right away. We treat the infection that they have, and
Mhm.
we hold off on treating HIV until we get the other infections under control, so that when we wake up their immune system by treating the HIV, it doesn't kill them just because we woke up their immune system.
Wow. Somebody asked the question, and I was looking at especially how it's transmitted. Somebody asked a question. What about getting married with it? What would you say about marrying if you are diagnosed, you're aware? Would you suggest somebody getting married? The fact that it's transmitted through blood, semen, pre-seminal fluid, vagina fluids, rectal fluids, breast milk. You know, what would be your suggestion as the question is being asked?
Mhm.
Maybe your answer,
So,
actually.
got you. So, when you look at HIV, that's why I said that if you are on treatment and you're sticking with it, you're taking your medication as you're supposed to, you live just like anybody else.
Okay.
And it is now talked about that treatment is prevention. Because if you are treating the HIV infection properly, you don't have the same chance to spread it, because the infection is so well under control that many people who are stably on treatment and doing very well and maintain their treatment excellently, they have an undetectable viral load, meaning the number of copies of the virus in the blood is so low at any given point in time that the chance of spreading it to somebody else is rare. It's not that it cannot happen, but it is so unlikely that there have been people in what we call serodiscordant couples, meaning one person has HIV, the other person doesn't. The person who has it is stably on treatment and doing well. And then you find that the other partner who does not have HIV doesn't get it.
Mm-hmm.
And when you find that they get it, may be a point where, for example, there were other drugs that interfered with the level of the HIV medications in their blood, or their partner's blood, or that the taking of the medication fell down and so the drug levels weren't maintained, or something else came along and made that person less able to keep their virus under control. Sometimes, if you get a cold or a flu, you can have a dip in immune function and a spike in the virus. And that can mean that for a short period of time, the risk of transmitting is higher. So, for people who have HIV and are under good care and doing what they need to do, the risk of transmission is so low that it is reasonable to be in a normal relationship like anybody else and expect that you can keep your partner safe. Although there are a lot of people now who are looking at PrEP, pre-exposure prophylaxis, where if you want to prevent transmission and you know you're regularly going to be exposed, then, or potentially may be exposed, for example, in a relationship like that where one partner has it and the other doesn't,
Mhm.
then you can take PrEP, which means a person who doesn't have HIV takes HIV medications to prevent themselves from getting it.
Oh, so that's an alternative too. So
That
that's
is also an alternative.
double protection kind of thing.
Mhm.
That's interesting. That's interesting. So so then if you know so the response is if you know somebody who may have been positive, then you can still be comfortable getting married to the person if you make sure that he or she is not falling off the medication.
It's
Make
a
sure
joint effort.
joint effort, joint effort. So the question that I wanted to ask and follow up on that, that means there has also there's also a need for regular testing to see if the blood is keeping up, the medication is working as it's supposed to.
Yes. So everybody who is on treatment really should get their regular checkups with their doctor, depending on the stage of HIV infection that you're at, how well you're doing. Some people see their doctor and get tested once a year. Other people get tested every 6 months or 3 months, depending on how well they're doing. For
Mhm.
people who are doing very well, and depending on the protocols in their country or state or town, then they might only need to get tested once a year. And then the only thing to maintain in between is all the regular good habits, including taking their medication on time. On time is very important, not just necessarily every day, but not changing the time of taking the medication because it only lasts a certain period. So if it's 24 hours, you really want to stick to 24 hours.
Right. That's the prerequisite, and that is the maintenance of your own life and the life of your partner. Well. This has been an excellent conversation with Dr. Kathy and Pate Robinson, live from Jamaica. Although we made a very late start, and I thought we it wasn't going to happen. I'm glad I heard from you just before I locked down and went to do something else. I was just
So
doing that.
sorry,
I saw
Victor.
your message come so much, but it's okay. I understand what happened. And this has been such an interesting conversation. I can't wait for us to do this again. Right. I want to thank you so much. I want to thank all of my friends and your friends. I don't know who is everybody there, but thanks for everyone who joined. I hope that you've learned something, and I hope that you're going to be looking out for the next time that you see I put up a flyer that says Dr. Kelly and Pete Robbins are going to be with me, and let's talk again so you know what to expect. This is the brat. There's going to be a lot more. Thank you everybody for joining me. I'm looking forward, and don't forget, if you haven't yet shared this, make sure you share it with your friends because there's a lot that they can learn from that. The other thing is, if you have not yet followed me on Facebook or subscribe to my YouTube channel, which is all free, then this is a good time to do it. And if you do go on my YouTube channel, make sure to hit the bell, and that bell is for notification that if I ever gone live, you will know that I am live. And by the way, if everything works well, every Wednesday, at least every Wednesday at 8 o'clock, my hope is to have somebody joining me on Let's Talk with the Doc. And you never know who is going to be coming up. Next week Wednesday, I have three incredible young people, brothers and sister, that they're just out of the world in ministry, and they all three are so engulfed into it. You have to join me. And then the following week, 2 weeks, and then the following week, Dr. Kenrick Semple is gonna be back. The scientist is gonna be back. So we're gonna be talking more stuff. So stick with me on Wednesday evenings, and let's talk with the doc. Dr. Robinson, I thank you so much. I am so glad that you are okay, because that was my concern. Please say hello to your husband and your children and
Well,
tell them thank them for allowing you, just as when you get your internet back, to just get on with the doc and spend this long time with me. I thank you so much. I'm looking forward to seeing you again. May God bless you. May you stay. By the way, I wanted to ask you, do you spend some time in England?
when I was a child,
Because,
before I turned 4.
okay, before you turn 4, and I still hear some little British slur in the accent. Every now and then I hear that. Every now and then I hear that bitter, and I hear that little bitter, and I could hear. I said, "Yeah, I hear some English thing in here. I am hearing some. It hasn't all gone." But I couldn't even imagine that it was when you were so young, and it stays there until now. But thank you so much. One of the accents I love when I was a young boy, I love British accent, and I still do like it. I like it even deeper because it is so interesting just to hear. Thank you so much, everybody. Thank you for joining me. I hope you have a great night and stay safe. Make sure wear your mask, stay the social distancing, do all you can to protect yourself. I have already gotten my first shot of the Pfizer vaccine. I'm looking forward to the end of the month to get my second shot, and then I'll feel like yeah. And by the way, I'm gonna just drink more water. You just inspire me to drink more water, more water. Thank you, doctor. As I'll see my pigmentation start to put on some more health again. I'm watching that. Thank you so much, everybody. It is Let's Talk with the Doc. Have yourself a great night. Thank you very much.
Thank
Appreciate it.
you.
See you soon again. All right. Take care. Bless you.